Thank you, Ruben. And good afternoon, everyone. My name is Pulin Wang. It's my great pleasure to be here today. Especially unlike Ronnie, it's my first time to be sitting on this stage, so it's my great honor. So I'll be talking to you about our ETA2 for continuous cardiac output monitoring. So about 1% of the U.S. baby is born with congenital heart disease, and about a quarter of them will have to undergo cardiac surgery right away. And low cardiac output syndrome is the most common complications after such cardiac surgeries, which can occur about 3 to 45%. And it also has a downstream mortality rate of 20 to 40%. These patients are also associated with patient who have LCOS is also going to have about 30% higher cost in terms of hospital costs, and also they're going to have to stay in the ICUs twice as long, with that also higher 30 days readmission rate. There are many different types of cardiac surgeries. However, all of them are common. All of them are associated with a high rate of LCOS occurrence. And low cardiac output syndrome can be determined, can be intervened early, which has much lower consequences. But however, there are no current technology that allows us for the continuous cardiac output monitoring. Continuous cardiac output is also crucial in the management of various other rare cardiovascular conditions, such as cardiomyopathies, cardio-oncology, and also post-chemosepsis predictions, and also monitoring of the cardiac arrhythmia. So current technologies for the continuous cardiac output monitoring are either minimally invasive or invasive. It requires long time to set up and also very cost prohibitive to operate. So at StretchMed, we have developed technology that's very easy to be implemented, which can be put on the patient for under 5 minutes, and it also allows continuous, truly non-invasive monitoring, and the cost for the device is only going to be less than $250. So here is a picture of our device, and the whole device weighs then less than 5 grams and can be readily stick onto the chest of the patient for over 24 hours wireless continuous monitoring. And how the device works is that we have integrated 3 different type sensors that are electrocardiogram, seismocardiogram, and photoplethysmogram, and these data can be collected in synchronized and concurrently, which allow us to defer the cardiac output in real time. And here is a comparison of our device against a commercial available continuous cardiac output monitor devices. The blue line is the data collected from our ETA2 sensors, and as you can see, it's much more stable than the commercial device. And also, you can see that it can cover a wide range of cardiac output values. So this project is the spin-off from the Professor Nancy Lu's lab at UT Austin, and she's with us today. She also has a prototype with her if you'd like to check out afterwards. And our device has been validated both at the Baylor College of Medicine as well as the Cleveland Clinics with Dr. Craig Rusin, who is also the CTO for sickbay at the Baylor College of Medicine. And also Dr. Shu Tandem is the expert in LCOS, and we have run over 17 samples on over 17 babies at Cleveland Clinic. Thank you very much for your attention. I'm very happy to answer questions.
Thank you. No, that's really amazing. I think I'm a pediatric neurologist. I work with children, and so anything that is less invasive and more wearable, I think I'm super interested in, is super important for us. Do you also see applications for this in, for at-home monitoring or replacing a Holter monitor or possibly monitoring other parts like an EEG or?
So the answer to that question is absolutely. So we're just trying to look for the first use case for this technology, where we think that for patients who have undergone the cardiac surgeries is the most in need because the high occurrence of LCOS. But because the ease and the non-invasiveness of the device itself, it can totally be used for at-home monitoring and for other type of monitorings. And also the key for this particular patch is because we can monitor all 3 cardiac parameters from on the chest, right? So that's kind of how we can get the cardiac output. And we do have other projects where we can monitor EEG, electromyograms, and the electric signals from our other body parts.